How do neurologists confirm a diagnosis of dementia? Have you ever wondered how neurologists confirm a diagnosis of dementia? The process is quite detailed and involves several steps to ensure accuracy. Neurologists start by gathering a comprehensive medical history from the patient, along with input from family members or caregivers when possible. This helps them understand the pattern and progression of memory loss and cognitive difficulties. They also collect information about medications, past medical conditions, family history of dementia, and lifestyle factors that might contribute to symptoms. Once the history is taken, neurologists administer a series of cognitive and neurological tests. These tests assess various cognitive functions, including memory, language skills, attention, and problem-solving abilities. Commonly used tools include the Mini Mental State Examination and the Montreal Cognitive Assessment. These assessments help to quantify the severity of cognitive impairment and track changes over time. Physical and neurological examinations are crucial as well. These exams help identify any other medical conditions that could mimic dementia, such as vitamin deficiencies or thyroid disorders. Blood tests are often ordered to check for these reversible causes of cognitive decline. Brain imaging plays a vital role in the diagnostic process. Neurologists often use magnetic resonance imaging and computed tomography scans to look for structural changes in the brain, such as strokes or tumors. In some cases, positron emission tomography scans are employed to detect abnormal protein deposits, which are associated with Alzheimer's disease. However, these scans can be costly and may not always be accessible. Electroencephalography, which records the brain's electrical activity, may also be used, especially if there is a suspicion of conditions like epilepsy. Recent advancements in technology have even explored the use of artificial intelligence to enhance early detection of Alzheimer's and other dementias. In addition to standard procedures, neurologists stay updated on emerging research that identifies patterns or pathways that increase the risk of developing Alzheimer's. Recognizing these patterns can help in identifying high-risk patients earlier and tailoring prevention strategies. It is essential to understand that no single test can definitively diagnose dementia. The diagnosis is based on a combination of clinical findings, cognitive testing, imaging, and laboratory results. Neurologists also take into account the progression of symptoms over time and their impact on daily life. This thorough approach ensures that the diagnosis is as accurate as possible and that other treatable conditions are not overlooked. If you or someone you know is experiencing memory loss or cognitive changes, seeking professional medical care is crucial. Early diagnosis can lead to better management of symptoms and access to support services. It may even allow for participation in clinical trials or emerging treatments. Always consult a healthcare professional for personalized medical advice, as each situation is unique. In conclusion, neurologists confirm a diagnosis of dementia through a careful combination of history taking, cognitive and neurological testing, laboratory work, and brain imaging. This multi-step process aims to provide the best possible care for individuals facing memory loss and cognitive decline. Ongoing research continues to improve diagnostic tools, offering hope for earlier detection and more effective interventions.